Partners in Health work in Lesotho is providing comprehensive primary health care services in rural, hard-to-reach areas of Lesotho. We started the program in 2006 on the invitation of the Minister of Health to provide HIV treatment and care for the hard-to-reach communities which had no access to HIV services. Later, we realized that we cannot really improve health outcomes if we focus only on HIV. So Partners in Health has expanded its services to other primary health care services, including maternal child health, tuberculosis, non-communicable diseases, mental health. And in 2007, PIH realized that there was a need to support the government of Lesotho to develop or implement treatment and care for multi-drug resistant tuberculosis.
Mental health services are not readily available, especially when you go to remote areas, rural areas in some parts of Africa. Can you discuss any challenges faced in implementing these mental health programs and also early childhood interventions?
We started with integration of early childhood development interventions into primary health care because we know that when you have a good foundation, you have better outcome. And we know that when it comes to child care, the first 1,000 days are critically important to build the foundation of physical and mental health well-being of anybody. So we integrated early childhood intervention into postnatal care, where we were taking advantage of having mothers when they come for postnatal care, and we train them on how to build the foundation using an intervention called Save and Return. And this has been also a good success for, to show what is possible to improve, the health outcomes of both mothers and babies. And one of the interventions that we had was to screen for postnatal care, depression. And we have realized that during the period of the intervention, 37% of mothers had mild or moderate or severe form of mental health. We then realized the need of expanding the integration of mental health into other programs like MDR-TB and overall primary health care. When we screen, we need also to provide care. Yeah. And we have diagnosed a lot of patients who needed care. And this has triggered us to invest more in a well-trained mental health workforce.
What are some ways that PIH has collaborated with local partners and governments in Lesotho to ensure that these health interventions are sustainable?
PIH way of working is through accompaniment. So we work hand in hand with local governments, and all these initiatives are discussed first with the government leadership, especially in the Ministry of Health. And once we agree that this intervention is really a good intervention that can help to improve health outcomes of the community, we go ahead and we implement. And we use the impact that we see on the ground to influence other partners and to influence also scale up of these interventions. So what we have seen from our experience when we introduced these new technologies, we realized that the impact was clear, and we were invited by the ministry's leadership, the Minister of Health leadership, to present the findings to all partners. And now we have Global Fund, World Bank supporting the government to scale up these interventions. And we feel like, we say we influence with evidence. This is what we have been doing, and this is what we are going to continue to do.